We are going to learn how to report vital data, temperature, pulse rate, respiratory rate, and blood pressure, also called as TPR-BP. How to report your result at end of practical in exam is very important. In clinical examination, physiology or in medicine, most of the time examiner will come to your exam table and ask, what have you done? Then you are supposed to tell your result. So let's start with very small portion reporting. Okay. How to speak result of examination of temperature, pulse, respiratory rate and blood pressure, which are also called vital data. So let's start with the blood pressure. You will report like this. I have examined the blood pressure in right arm of a subject in supine position and my result is 110 millimeter of mercury of systolic and 78 millimeter of mercury diastolic blood pressure. Okay, we will not speak like 110 by 78. You speak full sentence. I again repeat, my result is 110 millimeter of mercury systolic and 78 millimeter of mercury diastolic blood pressure. Temperature. I have examined the oral temperature of a subject. My result is 37 degrees Celsius. Whatever it is, 38.4. Okay. Pulse. When you are speaking your result of a pulse, all the headings should come in one sentence. Okay. You are not only supposed to, what people, students do, when they are asked about result, they make mistake. They only report the rate. Now remember, practical of pulse, there are so many headings to report. Okay. So I have put them in a formula so you can remember RRF, PF, SC. R stands for rate, second R stands for rhythm, then F stands for force, okay. P stands for pressure, also called volume. F stands for femoral, okay. S stands for bilateral symmetrical. C for condition of vessel wall. So how will you speak your result in a pulse? So I have examined pulse in a subject in a right radial artery which is 78 per minute, regular in rhythm, normal in force, volume and character, bilaterally symmetrical, condition of vessel wall is normal and there is no aortofemoral delay. Now to report aortofemoral delay, you speak only when you have palpated femoral artery because it requires exposure of genital areas, femoral triangle. Respiratory rate is recorded by the movement of chest wall upward and downward. So normal rate is between 12 to 16 per minute. So you can say like respiratory rate is 14 per minute in supine position.